Hospitals are rationing a pediatric cancer treatment due to a nationwide shortage. The drug, Vincristine, is in short supply because one of the two companies that manufacture it stopped making it. Fox's Kelsey Watts shows us the toll that's taking on families.
Me? What come I have to tell you?
5-year-old Eli Tilley was diagnosed with T-cell leukemia in July. As part of his treatment plan at Randall Children's Hospital, he needs 8 doses of the IV drug Vincristine in the next 2 months. But his mother just found out it's in short supply and being rationed. At this point, she says he'll get at least 2 doses, but after that, his access to the medication may be limited.
With T-cell, a relapse can be quite a big deal. It's very hard to eradicate the second time, and so it's important for us to kind of get it right the first time and get him all the treatment that he needs the first time. So it's scary not thinking that maybe we'll have access to some of that treatment.
Okay, so this is a single vial, 1 milligram of Vincristine.
Dr. Janice Olson found out about the shortage 5 days ago. Teva Pharmaceuticals stopped making it, and now the only other manufacturer, Pfizer, is trying to make up for the lost supply. But as it stands now, she says the hospital only has 1/3 of the drug they need to get through October. So now they have to decide which patients will get it and who can wait a little longer.
It is not an easy conversation to have. It is it's heart-wrenching, to be honest. I feel horrible when I walk into a family's room and say, I know your child is due for this medication today and we just don't have it. Or we have had to prioritize for some children who have a greater need than yours.
She says Vincristine is given to 90% of her patients, including every child with leukemia and most with solid tumors. But the profit margin for drug makers is small, and with future supply uncertain, they're making calls to other hospitals and adult programs all over the state looking for any supply that isn't spoken for. She knows it's an uphill battle.
There isn't a children's hospital in the country that's going to give up their supply.
I'll have to get the set of the Joker car.
And I know that many of these drugs do have really low reimbursement rates, but at the same time, these are kids with cancer.
Virtual doctor visits are becoming more common, but older Americans are more reluctant to make the switch. According to a University of Michigan poll, only 4% of seniors had a telehealth visit within the past year. More than 80% expressed at least one concern about virtual visits, like privacy and quality of care. But more than half said they'd be willing to try telehealth if they got sick while traveling or needed follow-up care.